When you think isometric contractions, you have to be able to understand the difference between yielding isometrics and overcoming isometrics, because they have been shown to actually lead to different types of adaptations in the tissues that are being loaded. So what's important to know between the two is that one is more of an eccentric intention, the other is more of a concentric intention. And how you set up the position of the body or the exercise is going to dictate how well you're able to differentiate between the two. Now, yielding isometrics, which are the type of isometric contraction that are more eccentric by intention, they are going to rely on your ability to resist lengthening. Okay, so yielding isometrics, a really good example, and I'm going to be using the 90-90 because I think it's a very easy setup to kind of like feel this out for yourself. If you go in the 90-90 and you get to your end range for your lead leg into flexion and external rotation, a yielding isometric would be you trying to maintain this position and not letting your body weight push you into more hip flexion, into more of a lengthened position for those lengthened tissues. So that's a yielding isometric, because I have to produce enough force and load to be able to resist the lengthening that my body, my center of mass, is trying to push me into. Now, when I want to shift over into an overcoming isometric, where now I have more of a concentric intention, now both, right, I'm pushing down into the floor, but this time, instead of just pushing enough to resist any more lengthening, I'm pushing max effort, max out all of your intention in order to try to create as much of a concentric intention or effort into the floor, which is an immovable object, right? The earth isn't going to move, but I can push as hard as possible. The big thing here is leverage. If your body does not have the leverage to express that level of effort or intention, it will not do so, because it will prioritize the position of the body, and it will only limit the force that you can create to what you can tolerate in order to maintain position. And a classic example of that is if you lean forward into that end range and then you push down into the floor as hard as you can probably get some really, really good effort, right? Especially if you push down through the floor and through the whole shin. Now, the difference between this and then grabbing my foot, closing this loop and chain, and then providing myself even more leverage, and then I'm trying to push even harder now into the floor and into my hand as I try and pull up. The level of contraction that I'm able to generate here and the level of like stability I have here doesn't even compare to just keeping my hands on the ground. And the only difference was I just grabbed my foot. Why is that important? Because if the goal of an overcoming isometric is to produce as much force as possible, you have to be able to set up the position of the exercise or whatever you're trying to address, and you have to set up the leverage so that the body feels that it doesn't have an instability or the positioning isn't like stable enough, right? It has to feel that it can create that force without losing position, right? Because if the task is to create as much force as possible, it's going to prioritize posture. But if I set it up to where I can push as hard as possible and as much as I can, but it won't really influence my positioning, I won't feel like I'm going to tip over, I'm going to feel safer in really maxing out my intention. And that is key, okay? Because if you don't feel safe, as much as you want to try and like push harder, you just won't do it. It's just that simple. And you can try this out, right? If I push down into the floor without connecting with my hand, I guarantee you'll feel a much deeper contraction if you try and push down into the floor while you try and pull up, because then you're setting up that leverage, okay? So yielding isometric, you're trying to resist any more lengthening, right? Overcoming isometric, you're trying to produce as much of a concentric contraction, but making sure you set up the leverage so you can actually do that. Now that was for the lengthen side. So let's talk about yielding versus overcoming and how to set that up for this closing side, right? A yielding isometric, like I said, you're trying to resist lengthening. For the closing side, you could do something like a passive range hold. So if I wanted to, I can take my foot, grab it with my hand, and I can just pick up my lead leg, just like this, right? So I am passively getting it up. I don't have to get it all the way to end range because I want to be able to stay in a position that I can control. Although if you wanted to add like an eccentric quasi-isometric, that's a whole different story. Anyway, if I just lift my leg up and I set my leverage up where I can post with my opposite hand, and I try and let go and hold this position, I am trying to resist the mass of my leg from lengthening the tissue that I'm contracting, right? So it's a yielding isometric. And because I'm like at end range, I actually have to try as hard as possible, right? But I'm still trying to resist a lengthening force, which is the mass of my leg, right? So if I hold here, I have to try and hold because my leg is trying to lengthen what I'm contracting. If I wanted to do more of a concentric overcoming, I need to push against something that's not going to move or something that's going to push equally as hard. So I like to set this up. Actually, I can just use my hand. I was going to use this block, but I can just use my hand here. And in this position here, I am now anchoring my hand, pushing down into my knee. And instead of me trying to lift my leg up, right, I'm trying to like push my hand towards the ceiling, but resisting equally as hard. So from here, I can really try hard. And I feel safe. I feel like I have position because I'm posted up. I'm not worried about holding a position because this isn't a balancing act. I need to set up the conditions to where I can really, really push up as hard as I can. And clearly, I mean, I'm not just pretending, I can really try much harder there. Now, if I wanted to, you can also manipulate leverage in this position by changing the position of your hand and tension, right? Obviously, that's going to be much, much harder, but I like to keep my hand here, but still try and push up with the knee and the foot, right? But like I said, kind of getting back to the point of setting up the position, setting up the leverage to make sure that it falls in line with your intention, whether it's a yielding isometric where you're resisting lengthening, or an overcoming isometric where you're trying to produce as much force against something that you can't necessarily beat. Okay, give that a shot. I think you'll see the difference. And just think about that. Next time you apply an isometric contraction, ask yourself: am I resisting lengthening, or am I trying to push and create more of a concentric effort? And get creative. That's where you are going to be able to manipulate positions and explore the intention of an isometric contraction. And I think you'll be surprised because it's going to open up the doors for you to kind of really get creative for people who are trying to understand this a little bit deeper, whether it's yourself or your clients or your patients. But given the fact that there have been differences in adaptation in tissues, I think this is just something that's very necessary to explore because it's going to make you a lot more precise with your prescription and intervention. So give it a shot, and I'll see you next time.